Hey there, welcome to Dr. G Pediatrics. In today's video, I decided to do a quick little run through about monkeypox disease, why it's an issue right now, what are the symptoms, what to look out for, and what you can do as a parent to stay protected or in the know. Okay, so there is currently a monkeypox outbreak that is occurring in several countries, including the United States, which is where I reside. I decided to do this video because it's getting a lot of media coverage. It's getting a lot of news coverage. Parents are getting worried. People are starting to stress. And there can sometimes be a lot of misinformation. And I decided it would be cool to do a video just to discuss monkeypox so that parents or caregivers, or if you don't even have children, you can just maybe feel a little bit more comfortable as to what's going on and what this means. So first of all, monkeypox is considered a zoonotic viral infection. And zoonotic means that the virus can transfer from a non-human host, such as an animal, and then be spread to a human. So that's what zoonotic means, and that's what monkeypox is. Monkeypox is not the same virus that causes smallpox, but it's kind of within the same family of viruses that causes smallpox as well as cowpox. Okay, so that's what monkeypox is. All right. Normally, again, this virus is not seen in the United States and the countries that we're seeing it. And so that's why it's considered an outbreak right now, because this is not a disease that's seen in the United States and many countries. And now there have been, I can't say a handful because the numbers are up to more than just a handful. So at the time of recording, I think we're at about 31 confirmed cases of monkeypox, and those comes from 13 states. And I'm just talking about the United States because that's where I reside. So we now know what monkeypox is, why it's an issue, because it's not normally seen in the United States and the United Kingdom, and now there have been reported and confirmed cases of monkeypox. So how can you get monkeypox? So because it's a zoonotic infection, which means it can be spread from animal to human, that's one way that you can get monkeypox. If you have handled a infected animal that has monkeypox, if you were scratched or bitten by an infected animal that has monkeypox, you can get it. Or if you have had any type of products or skin that has been taken from the animal and you got it on vacation and you have it, and that skinned product was from an infected animal, that's how you would be able to get it from the animal source. What's causing more of the concern currently is that you can also get it from human to human contact. And so monkeypox can be spread through respiratory droplets, so anything from the mouth or the nose. So when we think of respiratory droplet transmission, we think about viruses that give very small little droplets. Those smaller droplets kind of go in the air and they can stay suspended in the air for a longer period of time, whereas droplets that are considered larger droplets, they're going to come up and go down very quickly to the ground. So that's actually a good thing that monkeypox is spread through large respiratory droplets, because that means then for you to get the virus, you would need to have more of a prolonged direct face-to-face contact, talking with someone, for there to be that ability for the virus to be transmitted. Whereas with other viruses, which will not be named, can be spread through small respiratory droplets, so it doesn't take much for that particles to go in the air and be suspended for a longer time, where you have a higher rate of the virus being transmitted. So one human to human contact is going to be through large respiratory droplets. We also know that you can be infected with monkeypox from direct contact with the rash or lesion of monkeypox, which I'm shortly will go into the symptoms of monkeypox. But if you come into contact with the open sore or open rash of an infected person, or say for someone who's in the healthcare field, if you are handling soiled linens or clothing of somebody who was infected, that would be a way for it to be transmitted. Also, with any coming into contact with any bodily fluids of an infected person would be all ways that you can get monkeypox via that human to human transmission. What is still on pause, which has not been solidified yet, is whether or not monkeypox virus can be transmitted via semen and vaginal fluids. And that's important to point out, because right now a lot of the media attention is going to certain types of that it's maybe linked to sexual. It has been linked to sexual activity or sexual intercourse. So the current theory is that the sexual intercourse of the skin contact is which is transmitting the virus, versus saying the virus is actually coming from the sexual intercourse, where the virus is actually going through the semen or the vaginal fluids. So that is one of the things to kind of know. It's still kind of in limbo, and I will not claim to be the person who knows all about monkeypox, because I do not, and this is still evolving. So this is the current ways that are being discussed for transmission of monkeypox. So we've discussed what it is, we discussed how you can get it, and so one of the next things to know is, okay, what is the incubation period for monkeypox? And when I say incubation, I mean how long from time of exposure to the development of symptoms are you seeing with monkeypox? So right now, the average time from being exposed to monkeypox and then actually developing symptoms is 1 to 2 weeks, or 7 to 14 days. But they have seen anywhere from the incubation being 5 days, anywhere up to 21 days or 3 weeks. So there is a wide variability currently within the incubation stage of monkeypox. So now that we know what the incubation stage is, okay, so what are these symptoms? And this is the one that has, I think, created a little bit more angst in people, understandably so, because, I mean, we have gone through a lot these last few years dealing with the COVID pandemic. And I understand people wanting to be aware of what's going on and some of that angst that can come with it. So not making light of it, but it's all in the symptoms. This is what people want to know. So the presenting symptoms of monkeypox include fever, body aches, headache, fatigue, chills. I know, that's like a lot of different viruses. So there's very non-specific, what we consider prodrome, like the beginning symptoms of monkeypox. You can't tease it out. Like, you can't tease it out at the beginning stages per se, just based off of the symptoms, because there are different viruses that can give you those same symptoms. The difference is that what comes next with monkeypox. So what comes next with monkeypox is lymphadenopathy, which means the swelling of the lymph nodes. So the lymph nodes, it's not just located to the swelling of the lymph nodes in here, like in the neck area. There have been reported cases of the lymph nodes getting swollen in the underarm or axilla area, or down below in the groin area as well. So that is one of the kind of the bigger hallmarks of monkeypox, is that development of swollen lymph nodes or lymphadenopathy. And then the big key is the rash that's associated with monkeypox. So usually after about 2 to 3 days of symptoms, the rash starts to appear. And the rash in itself goes through a lot of different stages. The rash starts on the face, usually spreads down to the rest of the body, can involve the palms, can involve the soles. The rash, though, again, goes through many stages that can go through like a full 14 days. So the rash may start as flat, but then it creates to raised bumps. From raised bumps, the rash changes again to what we call vesicles, which are clear, fluid-filled blisters. And then a couple of days later, the clear fluid-filled blisters changes to more of a cloudy-filled blister or a pustule. And then it changes again to very hard, scabbed, well-defined or circumscribed lesions that they're saying has what we call a umbilicated, which means like a dimple or an indentation in the center, and becomes very hard and firm. So those are all the stages the rash goes through. We can probably nix out a lot of different viruses or concerns just knowing the progression of the way the rash looks, which is very different than compared to a lot of other more common viral infections that may cause worry or concern, because is this rash, this, or is this monkeypox? So just knowing the rash goes through many different stages, and it takes 1 to 2 weeks kind of for that full evolution of the rash. And once that is the end of the syndrome, once all of the rash lesions have scabbed over and fallen off. It's a lot. So again, there is some parts or symptoms of monkeypox that can be non-specific or maybe make you feel like, okay, worry, like I don't know what's going on. But then when you kind of take that in combination to the very distinct rash that develops in monkeypox, it should be able to quell some of those anxieties or fears. But so what can you do? What can you do for prevention? Or what can you do as a parent? Because you never want to feel, ill-prepared or feel like you can't do anything. But what I would recommend is to not be fearful, not to worry, not to be anxious, because that is not going to change anything, which I said. Should you be concerned? Should you be educated? Should you be well informed? Absolutely. And that's really the purpose of me creating this video, is just so that parents can just feel a little bit, or not just parents, people could just feel a little bit more knowledgeable or just a little bit more comfortable with monkeypox, just because what you see on, in news and media, it's supposed to be jarring. It's supposed to kind of grab your attention and give you that very strong emotion. But then after that, have some information. So because once you have that information is power. And then when you can get that information, okay, what it is, what am I looking for, that sort of thing, then that should make you feel more prepared, and it should kind of lessen some of that fear or worry that you may be experiencing, because everyone is currently talking about monkeypox. And then just from a safety measure in regards to just prevention, I know this sounds hokey, but this is a great time to be practicing hand hygiene, washing your hands thoroughly with soap and water or alcohol-based sanitizer is recommended for decreasing transmission, especially when a lot of people are traveling and, touching different surfaces and that sort of thing. So washing your hands when you are out and about in a very crowded place, not avoid touching your different openings on your face. So not rubbing your eyes, not rubbing your nose, not biting your fingernails. If you're going to be traveling in the airport, I don't remember the last time I was able to eat a snack with my fingers since the pandemic started because it's just the hands. So you can do, you can practice some proper hand hygiene and just kind of general things that seem, how's that going to help? But it does, right? Those are simple things that you can do. There are a lot of things we don't have control over, but those are some things that you can do to help prevent infection, whether it be monkeypox or any other infectious disease, because we know the virus can get in, but so many ways. So if you can do some things just to minimize that transmission, the better. So also, I would say, if as of right now, it's in flux. We don't know how big this is going to be. We don't know how many cases there truly are going to end up being. Right now, it's tied to certain traveling or contact with somebody who's traveled from certain places. But that's how COVID started. COVID started whereas if you had been traveling to certain places or had traveled from certain places, then you were at risk. And we just know that's just not what ended up playing out. That might have been where it started, but that's not how it continued to evolve. So I would say if I'm traveling with my family, like in an airport or somewhere crowded, I think wearing a mask is still beneficial, not just to prevent COVID, but I think right now it would be beneficial to wear a mask because, like I discussed earlier in the video, the transmission can happen from those large respiratory droplets or face-to-face direct contact. And we all know that the current state, that there's no one really social distancing, things are a lot more congested, things are a lot more crowded. So wearing a mask when you're going to be out in a crowded area, especially when traveling, would probably be a good idea until we get a better grasp on this monkeypox outbreaks and not knowing how long it's going to be here, how many more cases we're going to see. My hope is that it is mitigated quickly and it goes away very quickly and we can just continue living our best lives. But I think we can do some simple things just to at least, be cautious and prepare ourselves and prepare our families when we are going to be out and about, especially when we're traveling. Okay, and again, I am not an epidemiologist. I am not an infectious disease physician. So I am not claiming to be a monkeypox expert. I'm just kind of discussing kind of the big points and then the tips that you can do to protect your family. And like we've seen with COVID-19 and the pandemic, things change, science changes as we learn more, and things, recommendations may change. So don't quote this video when it's uploaded and say Dr. G said, because I am putting the snippet in here that things may change. We may see things evolve. We may see things change. So I hope you found this helpful or beneficial. Just gives you a little bit more information about what this monkeypox outbreak is about.